We have one last briefing that's on virus. I don't know that we could really spend much time on it, probably not. But before we pass over it, I just want to, colleagues, we got a copy of the report that was given to the county. We got it a little before 2 o'clock. It is alarming, to say the least. The numbers we just got that are going to be reported today show that the numbers in our ICUs have now gone over 100. Which was close to what we thought our capacity might be with the staffing that's been reduced. I'm sure there will be meetings tomorrow on that. I think that the number of admissions that's being reported tonight is 60, which gets us in the possible range for the health administrator to put us into stage 5, which is red, just days after we have gone into stage 4. I want to read a social media post that more people need to hear. This is a social media post a few hours ago. This is posted by a nurse practitioner in our city. The COVID census in my ICU had been growing steadily until today. Today it blew up. Blew up is all in capital letters. The ICU is filling up with very, all in capital letters, sick, unvaccinated COVID patients. Still have yet to see one in the ICU who is vaccinated. They are literally all on ventilators and or ECMO lung bypass. They are much younger and were much healthier than the patient population we saw in prior surges. They are also getting sicker faster and dying faster. I am angry. I am so angry. I am also sad and dismayed. The third round was entirely preventable. It is devastating to see and experience firsthand. The solution to this problem is very simple. Get vaccinated. Wear a damn mask in public. If we can spend 12 hours in respirators, CAPR helmets, N95 masks, and full PPE, you sure as hell can wear a mask to the HEB. Avoid crowds and risky situations. I don't know what is the indicated action. I think we need to huddle with the health folks and figure this out. I know that AISD has posted a survey on its website. I urge everybody to take a look at that and let the school district know what families are feeling about their children. I note that the CDC is now recommending, as of today, I think changed policy with respect to masking indoors. Inevitable based on everything that we're seeing. Get vaccinated is still the primary message here. And then I'll just conclude with, I saw that the governor, in response to what we're seeing here now in these responses, in response to school districts that are asking for the permission to be able to protect their students by requiring masking in their schools and can't do it because under what the governor is doing, they will lose financing and money to be able to run schools if they do that. That in response to that, the governor today issued a statement saying that every Texan has a right to choose whether they will wear a mask or have their children wear masks. And I don't know where we find that right. The right to be able to fill up our ICUs and prevent people who are having heart attacks from being able to go there. The right to be able to put nurses in our ICUs and our emergency rooms at risk. I don't find where that right exists. And I applaud Ascension Seton today, which apparently is now asking its associates to get tested in order to be able to work in a hospital. If I went into a hospital right now, I would want to make sure that everybody in that hospital that I was running into on that staff were people that had decided to get vaccinated. I think that would be my right. we have a problem here, and it is not getting appropriate attention or response. Sorry. Anybody else want to say anything about COVID before we move on? Yes, Councilmember Kitchen.
I just wanted to say thank you, Mayor. I know that you've been on the front line with this, and all of us really appreciate that and appreciate the messages that you are sharing with the public. They are so important, and I just want to say thank you for that, and I will echo those as much and as loudly and as often as I can.
Thank you. Councilmember Alice?
I'll be brief, as I like to be. It's really been a struggle as we're kind of going into this next phase and another wave and dealing with a variant that, you know, is spreading way too fast. And I'm tired of wearing my mask too, but I still put it on. I put it on for other people. I think about kids that are too young to get vaccinated. I think about doctors that are exhausted. I think about folks with immunocompromised systems and older folks. And I'm tired of it too, but this pandemic doesn't care what you think. And I think it's really important that we do what we can to protect others, because it's the very least that we can do.
Councilmember Fuentes?
Thank you. I think we've all read and heard that this is the pandemic for the unvaccinated. And so for me, hearing that we are on the precipice of entering or elevating our stage is extremely alarming. And it's a call to action that we have to do more to address vaccine hesitancy. And I know it's really unfortunate that we don't have time today to receive a full briefing. I would like to request the daily emergency operation EOC briefings that are given because we are in a crisis mode and we should be treating it as such. There's not a weekend that goes by that I don't hear from someone in my community who talks to me about a loved one that they have lost. And so this pandemic is still very, very real and very prevalent in our communities. And so to echo Councilmember Ellis's statement, you know, we have to mask up and do right by our community. Thank you.
All right, as we close out our meeting, let's go to